Good morning, everybody, and thank you for the introduction, Karen. As Karen has just said, my name is Sharon Williams. I'm Compassionate. I'm the project manager for Compassionate Communities Northern Ireland, and we're currently based in Foyle Hospice, and we have partners in the Northern Health and Social Care Trust that I'll explain now in a wee minute. So my hope today is that you will hear something that will encourage you to take the first step in reimagining an improved experience for people in your community who are impacted by dying, death and bereavement. Our story is our story. It's individual to us because each compassionate community is unique. And they're built on what community assets you have and what the need in your community is. I want to explain why we considered compassionate communities, which is a whole population approach, a solution to the growing need for palliative care. Dying over the last 50 years has happened predominantly in acute settings and in nursing homes, and therefore we've lost a lot of the meaning in death. And as a result, many of us feel disempowered to offer emotional and practical support. Sadly, this leaves those dealing with failing health and advanced illness feeling socially isolated and lonely. And this social death is experienced also by our unpaid carers and by those living with bereavement. So the challenge, therefore, is to break down the taboo and open the conversation to build capacity in our communities that support people and to empower people to make decisions for their future care needs. Now, we know a person's health is 80% determined by factors outside the healthcare system, with factors like education, housing, employment, and the environment, and so forth. With an overwhelmed health and social care system, we must look to ourselves and to each other, because together we can influence healthcare outside of the healthcare system. So why is a compassionate approach needed? Just really want to apply this to the Northern Ireland context for a minute. So the population this year stands at under just 2 million, and we can approximate 1% of the population is going to die. So over about 19,000 will die this year. About 75% of them will die from advanced illness and frailty, and therefore would benefit from a palliative care approach. A small proportion of these will require specialist palliative care, but the majority will be living as well as possible in our community, with input from GPs and district nurses. By 2040, the number of deaths increases as our ageing population start their final journey. The number of people who would benefit from palliative care rises to 18,554, and community deaths are expected to rise by 74%. Over 190,000 people will be left living with bereavement. They will continue to live in our communities and work in our workplaces, and will need support from family, friends, and policies and employers, and so forth. The need for social and practical support in our communities cannot be greater. Don't know if you've heard of the 95% rule, but I was a great student, Alan. So just really wanted to demonstrate what this looks like. To appreciate the importance of community support, I would like to address the misguided belief, as Alan has very well put it this morning, that a lot of time is spent with healthcare professionals. And indeed, people are travelling to and attending appointments, and they have healthcare professionals visiting their home. However, the reality is 95% of their time is spent at home. That might be spent with family and friends, but for many, it is actually alone. To demonstrate this further, I want to present an assumed support network for somebody who's perhaps of working age. On the left, you can see healthcare professionals that are providing care for this person. And on the right, you'll see a much wider network of family, friends, work colleagues, partners, friends, etc. We can see the potential for greater support as possible, but unless this support is mobilised, this person may also be isolated. I want you to consider this person now for a minute. This person is probably 80 or 90 years of age. It is likely their partner has passed away, as have many of their friends, so they're grieving. Adult children perhaps have moved away, and they're living with a comorbidity for a number of years, therefore they have reduced mobility, and they rely on public transport. They have carers that visit them 3 times a day. What does their day look like? They spend 95% of their time with their dog or cat, the radio or the TV, and they are waiting to die, fearful that they'll do so alone. This person is likely to suffer a social death long before the biological one. And we used to run a befriending scheme, so I have gone into homes where people have said they are scared that they're going to die alone. But now I just want to take some time to look at how the project has evolved. The project was initiated in 2015 with funding for an 18-month project and was subsequently extended. In that time, we established a befriending scheme with 2 community hubs, built relationships with healthcare professionals and community leaders. The project engaged with the wider community through a conference, a city-wide conference, and an art exhibition. The befriending scheme was highly successful in that we were able to match volunteers and clients, and some of these relationships went on to be long-lasting friendships. By 2019, the befriending scheme was overwhelmed with referrals, and it really called for a reassessment. And then a few months later, COVID hit and thrust us into a series of challenging lockdowns and changed the world for everybody. Our befriending scheme was reduced to phone calls, but this gave us time to explore who else was out there invested in this public health approach and how could we increase our reach and our impact. It was at this time, over screens, that we collaborated with 2 statutory organisations, the Northern Health and Social Care Trust, who operated Compassionate Communities Northern Project, and Fermanagh and Omagh District Council. In the Trust, we were working with the Macmillan Service Improvement team and the Community Health and Wellbeing Department. And in Fermanagh Omagh District Council, we were working with the age-friendly officer. But during lockdown, we delivered 2 online events, Dying Well with the Northern Trust and an arts-based age-friendly event with Fermanagh Omagh District Council. Both partnerships have flourished and continue today. In fact, the age-friendly officer in Fermanagh Omagh subsequently moved to Cavan County Council, and we're now working collaboratively with them and the Irish Hospice Foundation and a number of other organisations cross-border. In 2022, we received funding for 3 years from the Strategic Planning and Performance Group, and we work on some regional work streams with the Palliative Care and Partnership Group. But I really want to go back and highlight the partnership between what we were at the time, which was Compassionate Communities Northwest and Compassionate Communities Northern. In 2022, we formalised this partnership, and now we're known as Compassionate Communities Northern Ireland. And this partnership has truly been transformative and demonstrates the effectiveness of cross-sector collaboration. And evidence of the benefits of this partnership can be seen at our events and in the library of resources that is freely available on our website. We blended skills and experience from community and from clinical staff to co-design information tools and increase awareness. To do what we do, we need community partners and champions. The project has been able to evolve and develop at scale, having a wider impact because of the partnerships and working with others. As I mentioned earlier, we are collaborating with Cavan County Council and the Irish Hospice Foundation in a project called The Art of Life. Essentially, its aim is to normalise conversations around dying, death and bereavement, using art-based activities as a vehicle to help people reflect on what's important to them so that they can plan for advancing years with agency and independence. So, since 2022, the project's lens has become more focused on building a compassionate infrastructure through education and awareness. Using a compassion-based approach, our objectives are to improve the experience of advanced illness, frailty, caregiving, and bereavement through improved death literacy, increased death preparedness, and increased community capacity. In our time, we have discovered compassionate communities in our healthy living centres, our community hubs. And in Oma, I came across an organisation called Care for Cancer, who are supporting people living with cancer, who is 100% funded by local people. And Rosie's Trust, another one of our exemplar projects today, is working across Northern Ireland, keeping people living with a terminal illness together with their pets, which is probably their only companion. So what do we offer as a project? The Compassion in Action programme includes a suite of workshops, information sessions and resources to help people understand how they can help each other and the importance of and the impact of small acts of kindness on the bigger picture. We used to go in with Plan Ahead and advanced care planning, and we didn't get a great reception. So we then decided to go back and look at how we could really engage people. So that's why we developed this Compassionate Conversations workshop, which is very, very popular. So this is how we start those relationships. This is how we start to build trust with our partners. We demonstrate the well-being benefits of receiving compassion, but also of giving compassion. And in fact, somebody who witnesses that exchange also gets that feeling of well-being. We have delivered to carers, people living with bereavement, and support staff working in our homeless sector and in our health and social care sector. Many of these people work with their heart, and many of them are burnt out. So the self-compassion and self-care element of them is really, really important. Bereavement support is another area that we've identified as a great need within communities, both for people that are living with bereavement, but also for people who are supporting them. So we have about 2 hours long, and it really just introduces understanding grief, physical and emotional symptoms, types of grief, and how to support someone who is grieving and looking after yourself. Our Plan Ahead workshop is about 1.5 hours long and covers the 4 components, personal, clinical, legal and financial. And we look at how to explore the benefits of planning ahead and what does that look like and the necessary steps that you have to take. We also host a Plan Ahead week, Awareness Week in March. And for the last 2 years, we have partnered with Derry Strabane Council. And for 25, Mid-Ulster District Council and Lisburn Castlereagh City Council have approached us to do something similar. Community engagements is just like a summary of over the last couple of years through our events and workshops. We can confirm also, aside from that there, that our website is accessed by 500 users each month, and that our YouTube digital assets attract hundreds of users each year. Membership to our social media channels continues to grow, as does the engagement with its content. This is just some of the feedback we've received. There's one there from a lady who attended the Compassionate Conversations workshop. She was a carer, and she said, I felt a lot more relaxed and able to cope. It was really great to meet new people and to share our stories. And at that workshop, I really got the sense of isolation from these people, but also the power in them coming together. That peer support was really, really beneficial. So we use the arts in engaging the public. We've used a number of artistic initiatives to engage people on what is a highly emotive topic, because it helps people to access and process complex information in a less threatening way. The arts go beyond words and help people to identify with who they are, and they also give them a sense of purpose, and that leads to hope and healing. We run 3 principal awareness campaigns every year. plan ahead that I've just spoken about, which is in March, and that we've been working with Derry Strabane Council. And this year, the council have actually now put a plan ahead page on their website, so we think it's a really good thing. So I'm signposting everybody, any other councils to do the same. In May, we run events around Dying Matters Week, and in September, we also work with the Institute to spread awareness about palliative care. A recent event that we partnered with was the rural event for what was looking to engage farmers' wives with this very motivational speaker, and we worked together with the Northern Trust Rural Support and Ulster Farmers Union. And it was really, this lady here is from a farming background, hugely popular. She has been to Northern Ireland before, but we had a full room. There was people, we actually had to turn people away at the door. And I'm hoping I might just play a little bit of what she said because she's so engaging. We try to be creative. Also during that event, we had a live performance of the play Sharon 76, which was commissioned by the Northern Trust as well. And I'll talk about that in a little while. So some of the visual arts that we've used include a photographic exhibition. We've been able to utilise community assets such as artists, gallery facilities, photographers, and connections to people who are accessing palliative care. So we've been able to co-design these project legacies on very modest budgets. And as part of Palliative Care Week this year, we're going to be launching a Before I Die wall tomorrow, which is a community art project it's a 24-foot, almost like a blackboard scenario. It's going into the Guildhall for the best part of the week. And so we're quite excited about that there. I don't know if people are aware of the Before I Die wall. It's a global initiative that travels. It doesn't travel, but pops up at festivals, shopping centres. And it's just a sort of a way to engage the public to thinking, what is it that will help me lead a purposeful life and about planning ahead, So to try and unpick some of those big questions we run away from or we don't give any time to. We are engaging with a local comedian who's going to go out on the street, and we've got Voxbox people going out to record the conversations that are actually going to be happening out there. It's been picked up by the media, newspapers, radio, and UTV are actually coming down on Wednesday as well. So it really demonstrates the power of the arts in opening these conversations. And some examples of the literary resources include a Life After Death book. This was a collection of poems donated by a volunteer. Margaret Robinson took to creative writing to process the death of her husband. And she wrote these series of poems and she donated them to the project. And we have published them, and there are some copies on our stand at the bottom. Just a very beautiful book, and we do get requests now across Northern Ireland for other copies. We're very grateful to Margaret for her generosity. Another example is the Big Book Club Night, which took place during Dying Matters Week in 22. This event offered the public an evening with a local author, Emma Hetherington, who had written a book, One More Day, which was a book reflecting on grief. And we also referred to the Northern Trust, the play in 2017, Ceremony 76, which was written by Emma also. And we've had that performed by several amateur groups in place-based scenarios. It's a 10-minute play. It's very funny, but it has a serious undertone, but it does get you thinking. Again, there's a copy of that, the original screenplay, available on our website if you're interested to go and see what that looks like. Just moving on to Death Positive Libraries. This is an initiative which we started with Derry Central Library in 21, in the middle of lockdown, and in partnership with Libraries NI. This initiative has now been extended to 5 other libraries in Northern Ireland. And what we tend to do there is run workshops in those libraries. And we also have a Before I Die wall in those libraries. So in Oma, I went down to visit and children had come in and filled it in. So I want a hamster and I want to be president. So, you know, we're trying to get it upstream. We were able to extend this initiative with seed funding from the PHA. And we were able to get books that weren't in libraries that were looking at topics around death, dying, and bereavement. There are further 8 death positive libraries planned over the next 12 months. So it's partners such as Cavan County Council recently secured funding from Creative Ireland to extend new libraries in Fermanagh and Cavan as part of their Art of Life project. We've developed a number of educational resources. Again, all these resources are available free on our website. And it has involved some face-to-camera. So we have had a lot of healthcare professionals feed into this. People in the legal sector as well. And it's just really to give people the information, you know, that they can go find it for themselves. It aims to improve educational resources throughout, and our website contains blogs and other articles that people can refer to. I would like just now to play one of the animations. We have 4 animations, so bear with me.
Life can change in an instant. You can be active and healthy one day and be diagnosed with a palliative illness the next. A palliative illness means your illness can no longer be cured, but you can still get different treatments to help manage it, which could be for years. Everyone reacts differently to living with a palliative illness. Some people describe their emotions like being on a roller coaster. How you feel and what you think can change from one minute to the next. But you're not alone. Palliative care services can be provided in your home, in hospital, in a care home or nursing home, and in a hospice. Services can help you and those important to you with your concerns, and not just physical symptoms. Palliative care is about quality of life, living as well as you can for as long as you can. This care can help you to manage your needs now and support you to think and plan ahead. Talk to your GP or district nurse to find out what palliative care services are available in your area. Often family, friends and neighbours will play a vital role in supporting you. People want to help you live as well as you can. They can help in practical ways like cooking a dinner, collecting a prescription or taking you to an appointment. What's important is they want to be there to support you and your needs. Small acts of kindness can make a big difference when you're living with a palliative illness. You're not alone. Support is available for you and for those important to you.
That's one example of the resources, again, that's freely available on our website. I think I'm over time, so I'm going to push on here. As part of our regional remit as well, we started a community of practice and we're in back in 22, really as a way to facilitate shared learning and best practice using a multi-agency approach. We meet quarterly, and the topics are those that are elected by the members and guests who come along to deliver. We've had so far compassionate schools, death positive libraries, read yourself well, advanced care planning for people living with dementia, and so forth. As I mentioned before, we have a regional website. Please go use it. It's free to share. And I would like to thank our supporters, our funders, because without their support, none of this would be possible. It is the power of community, the tenacity and commitment that makes things better and transform communities into places where we can live well until the end of our lives. And it's the richness of diversity and inclusion that ensures we celebrate every life in our community. Finally, I want to leave you with a quote from philosopher Aristotle. We are bigger than the sum of our parts and better when we work together. For anybody that has interest in talking about setting up their own compassionate communities, please come and talk to us. We'd be more than happy to perhaps offer some guidance and support. Thank you for listening.